I'm pleased to welcome you to the 10th installment of our community speaker series on COVID-19. Today we have the pleasure of hosting Dr. Natalia Ramos, an assistant clinical professor at UCLA and the medical director of the Empowerment Program for LGBTQ Mental Health, as well as the esteemed Ariel Bustamante, training and coaching manager with the Los Angeles LGBT Center. Let's welcome our speakers. Thank you so much for being here. And let's turn to our first question, and we'll go ahead and start with Ariel. Ariel, please introduce yourself and tell us a little bit about your background.
Sure. Thank you all for having me today. I'm so excited to be able to share some information with you. My name, as Taylor mentioned, is Ariel Bustamante. My pronouns are she, her, hers, and ella. And I manage training and coaching at the Los Angeles LGBT Center for our Children, Youth, and Family Services Department. For folks who don't know, the Los Angeles LGBT Center is the world's largest LGBT organization, serving over 50,000 people every single month. And during this health crisis, we continue to have our doors open, providing all sorts of essential services, such as a food pantry, a drop-in center for youth experiencing homelessness, and life-saving medical treatment at our federally qualified health center. My background is in equity and inclusion, as well as policy. And so I have the pleasure of being able to work with communities across the country, jurisdictions across the country, who are seeking to better their work and the outcomes of LGBTQ plus youth in the child welfare system and the juvenile probation systems. And we do that through direct services as well as through training and coaching with those different jurisdictions.
Thank you so much. And Natalia?
Hi, everyone. Thank you for attending today. My name is Natalia Ramos. I am a child, adolescent, and adult psychiatrist at UCLA. I should mention my pronouns are she, her, hers as well. I wear many hats at UCLA. One is seeing patients directly. I mostly see LGBT patients these days. I'm also an assistant clinical professor, and I run a clinical program called the Empower Program, which is a comprehensive mental health program for LGBTQ clients. We treat all mental health concerns and especially focus on providing affirmative care models. And then lastly, my kind of third hat is with the DMH UCLA Prevention Center of Excellence, where I develop curriculum and training and different types of resources for sectors countywide for those working with LGBTQ clients as well. Thanks for having me.
Thank you so much. As you can see, we have two very esteemed speakers with us today, both with an overwhelming level of knowledge that we're so excited to share with everybody joining us. So we're going to go ahead and start by talking about some of the issues that each of you are observing that are coming up during COVID-19 that are unique to LGBTQ youth. And let's go ahead and start with Ariel.
Sure. So just to bring folks into the conversation, when we're talking about LGBTQ plus youth, we're talking about lesbian, gay, bisexual, transgender, queer, and questioning young people. Generally 24 and under is how, at least at the center, we categorize youth, and certainly other spaces, other agencies may have different age ranges. But just to give you some context there. And you know, we're thinking about the population nationally, right? That's around 10 to 12%-ish is what a lot of the studies say. One of the biggest things, though, that we're seeing right now is challenges in serving youth who are experiencing homelessness. In non-pandemic times, the rates of homelessness for youth experiencing, homelessness is around LGBT identity is 40% at least. That we know of. And that is of great concern, because during a time like this, when access centers and other spaces are unable to provide some of those same services in person, and potentially longer term, even after doors reopen, I think that's something that we have immediately seen. As I mentioned, we have a drop-in. And so, we're seeing all the different basic needs, much less all these sort of secondary needs being exacerbated. So everything from healthcare access to meals, housing, etc., is a really big concern for us. And so that's something that we've kind of been monitoring closely here in the Hollywood area and LA County, and thinking about how are we making sure that youth who are experiencing homelessness are having access to those services, especially in an affirming environment? That's sort of the key part, right? That youth across the county and elsewhere in the country certainly are able to access all of those that service. So that's one of the big things. Another thing I wanted to sort of touch on was around the child welfare system is aging as well as court issues. So knowing that, within COVID, there's still the potential for youth to be aging out. And how are we addressing that in different jurisdictions? The state of California and LA County has been looking at that and putting into provisions to be thinking about that more generally. But it's certainly something that, probably within the first couple of weeks of LA County starting to shelter and isolate, we immediately started receiving calls from youth and workers alike saying, I have a young person who's going to be aging out soon or has just aged out. What are our options? And the court issues sort of remain as well, because many courts across the country are not open for non-urgent issues. And so something like gender affirming care for a youth who's transgender and wants to access hormone replacement therapy might be something that's considered non-urgent versus say, removal order or something like that. And so I think those types of issues are things that we have top of mind. But I'll turn it over to Natalia, because I imagine you have some other things that you're thinking about.
Yeah, thanks, Ariel. So I'll just add a little bit more on the mental health side. Obviously, depression, anxiety, gender dysphoria, et cetera, haven't disappeared because COVID's on the scene. So we're seeing a lot of those issues ever present, and in some cases be exacerbated by societal conditions right now. One big theme for us in thinking about youth is isolation. A lot of LGBTQ youth are more isolated than ever before. They've suddenly lost their spaces at school, their supports through schools, summer camps have been canceled. A lot of our youth look to external spaces, such as the center as well, to tap into those support networks. So the support networks have suddenly been shrunken without any anticipation. Sort of within that vein too, we think about family dynamics and family acceptance versus non-acceptance. I see many youth that are essentially not totally out at home or not out at all or not safe coming out at home. So there's a lot of issues around disclosure and privacy and sort of having to keep identities to themselves, which again sort of ties back to my first point around not having other outlets for those aspects of identities like before. Ariel alluded to this, but I think more on the medical side, there's a real dearth of care right now, and more so a perception that care is not accessible, more so than ever. LGBTQ patients, traditionally have more difficulty accessing healthcare services for a variety of socioeconomic reasons, and also, interpersonal and social reasons. And many clients right now aren't able to access testing, gender affirmative services, et cetera. And that obviously is having a big impact on mental health as well.
A couple of follow-up questions. Both of you are working on the ground right now in the sense that you're still seeing young people and interacting with them. We know that Ariel is in fact at the center right now. I'm just wondering if you can speak to some of the differences in the conversations that you're having with young people right now, their concerns that they're raising, perhaps some real life examples of what's been going on, bearing in mind confidentiality.
Sure. So, as I mentioned, literally within days of LA County beginning to sort of scale down what was happening in person, as I mentioned, we got calls and emails from social workers, from youth. One youth in particular let us know that they were aging out, and their resource parent or foster parent specifically said, you're aging out, your case is going to be closed, and so we need to sort of figure out how to transition you out of the home. And I know for that particular youth, that was incredibly scary for them to be thinking about just generally, right? That's a tough transition for many young people when they are aging out of care or their case might be closing. But on top of that, we're in the middle of a pandemic. And so thinking about how do I navigate all of this? And so that was something that was immediately brought to our attention, knowing that, safe spaces and aging out. When we did our research with the UCLA Williams Institute in 2014, we looked at things like congregate care and aging out without permanency, and we saw these same sort of negative outcomes. And so again, that sort of being exacerbated. For a lot of the youth who are experiencing homelessness, we run, as I mentioned, both a drop-in center and residential programs. And so, just generally, it's very difficult for many of us, especially young people, to be able to stay at home, and that's just been a challenge. But specifically in the sense, as you mentioned, Natalia, that connection, being able to go out into the world, be around peers who are affirming, be around adults who are affirming, who they may not live with, but are there as a informal support. And so that's something I think that's been a challenge. And then the other thing as well that Natalia started to speak to was this idea of homes not being safe. And across the country, we've seen things like reports to Child Protective Services go down as far as child abuse goes and neglect. And so knowing that, there's likely many young people who are unsafe at home right now, but who don't have an outlet, another adult in their life, somebody who, like a school teacher, might be able to observe these changes and elevate that concern to folks who can better intervene and provide services to families.
Natalia, anything you'd like to add?
I think I can add a little bit more about access around medical services and mental health services. I think that's kind of an ongoing theme. A lot of youth have fought really hard for access. And very much have been looking forward to and anticipating a variety of affirmative care interventions, from hormones to surgical interventions to other things. And all of that was more or less suddenly put on hold. Some of it is sort of slowly resuming, but at a delayed pace. So we've been seeing a lot of youth that just kind of have a lot of disappointment and difficulty with that, and sort of worsening depression type symptoms related to that. We've talked a bit about the isolation factor already, but that's definitely a big ongoing stressor that kind of makes the rest of these things all worse. And then I think the third one that maybe is a little bit new that we haven't talked about is sort of the needs of families. Parents and caregivers are sort of also suddenly stuck at home with their youth. It does go both ways. And we are definitely hearing from more families, and especially kind of somewhat distressed parents, that maybe we're kind of avoiding hot topics or issues or conflict around identity, but now can't really avoid it because everyone's together all the time. I think one sub part of that too is oftentimes there's a more accepting family member and then less accepting family members. And a lot of families are kind of rapidly adjusting to those dynamics and dealing with those conflicts right now as well.
And Dr. Ramos, does the conversation with parents look any different right now in light of COVID that you're having?
Yeah, I mean, it's a really interesting question. We often, we always work towards increasing support and reducing rejecting behaviors in the home. But I would say right now it's a little bit more of kind of a pause model, especially in high conflict homes, especially those that might involve, suicidal thoughts on the youth side, or any type of violence or kind of interpersonal conflicts that are severe. So one of the things we're working more on now than before is kind of helping everyone get their space and have like a safe space at home and a place where they can be away from other family members, especially those that they have conflict with or that really might not be as accepting.
So for folks joining our talk today who may find themselves, I don't know if you could hear the siren, but for folks joining us today and may find themselves either as a young person at home and feeling rejected, or as a parent who might be spending more time with their young person and therefore observing things that they didn't necessarily know about before, or for social workers and other folks perhaps working with either parents or young people. Any suggestions based on the experiences that you're seeing and the experiences that you're living on how to best cope, and some strategies to perhaps employ in the home, or for somebody who's working with families that are at home?
Do you want me to start, Taylor?
Sure, go ahead. Thanks so much.
So, again, I think this idea, I have a couple more kind of general thoughts around, routines and boundaries and sort of physical spaces. I think those are three really important themes. So people kind of in the house know what to expect each day, kind of, who's going to be where. I think for LGBTQ youth, especially, to have a space where they can, sort of hang out and be safe, or hopefully access their friends or other affirming media online. Those are all really big. I guess I'll pause there and see, Arielle, you probably have other things to add.
Yeah, certainly one of the things that I think from a provider perspective that we can be thinking about is ensuring that connection to resources in an accessible way. So I love that we're doing, Spanish translation today, for example. And so, in the vein of how are we supporting families and caregivers, are those resources accessible, right? We are in a space where we can be handing out pamphlets and things like that. And so do we have resources that are going to also have different modalities? One of the things that I'm really enjoying these days, and that I know a lot of our clinicians have recommended to the members that they work with, are two different apps that are really helpful. So Calm and Headspace. Total shameless plug for that, no affiliation, but I know in LA County they are currently free for residents. And so also trying to think about, what self-regulation and coping mechanisms and resources do folks have, whether they're adults or youth, and do they have sort of self-care plans in place? I think is something that you can kind of think about, whether you're a youth or you're an adult, is do you have a plan in place ahead of time for these different scenarios that might come up when you feel sort of activated or triggered or just generally stressed, whether it's about COVID-19, your identity, or just something else happening in the world. There's a lot of milestones that young people are missing out on right now, like prom and graduation and the end of the school year. And so also thinking about how do we make space to celebrate those moments in a way that allows youth to still feel like they're special and they're loved, and that those things still matter right now, I think are also critical. And I would definitely say if there are any youth who are viewing this today, I would love if you could please in the either chat or Q&A, put in your suggestions. We want to hear from you of what you need.
Yeah, I'll just add one more thing, which is kind of on the caretaker side. I think the more we can kind of emphasize and focus on caretakers and encourage their self-care and really formulate concrete plans of self-care with them, that obviously helps the whole family dynamic and the youth indirectly. Another thing we often suggest to caregivers is seeking and finding their own supportive space right now that's away from their youth, particularly important if they're stressed about COVID and or processing their own thoughts and feelings about their youth's identity. So having a separate space for them to sort of explore that, either informally with friends or families, or more formally through support groups or therapy or things like that.
Thank you. I also wanted to go back to something that Arielle mentioned around homelessness. And we know that along with homelessness comes a lot of other challenges, and in some instances, acts based on survival. And I'm wondering if you're seeing an increase in that, if you're seeing an increase in, more challenging circumstances that young people who are homeless are facing, and if you can really kind of delve into that a little bit more.
Yeah, I think, so one of the things that we're seeing a challenge with here in LA County, and I imagine is likely in other spaces, is A number of shelters opened recently to house folks. And what happened is these shelters, although great in theory, are age-integrated shelters, meaning that they're sort of open to anybody who wants to be able to access them. And so that presents a challenge just generally for youth and adults to be sort of sharing a space like that, youth, 18 and over, that is. And then also, again, that those spaces aren't inherently going to be affirming, right? They're sort of triaging the situation as best as they can and trying to find solutions to housing. And they're not necessarily spaces that when we refer young people to, they're likely to stay in for more than a couple of nights, if at all. And so that's definitely a concern for us, is just, again, knowing that the beds are available to youth and that those beds are affirming, because we want them to be able to stay in those places. One of the things I know LA County is working on, and actually I think across the state of California, is an initiative called Project Room Key. And so the whole point of that is helping get folks who are, in increased vulnerability health-wise into a hotel room. And the idea is, other than some of these approved activities like work or going for a walk, you're able to then have a consistent physical space that you're able to shelter in to help, lower the curve, as we're talking about. So that's sort of in the immediate. And then long term, again, we're also seeing, programs being cut or reduced. And so making sure that folks are having access to providers, case managers, et cetera, who are thinking about models like family acceptance and thinking about family connections and that sort of thing. And how are we centering all of these conversations in permanency? So that's another element to it. And then as far as sort of survival crimes or other behaviors, I don't know that we've necessarily seen an uptick in that, although, we certainly have continued a harm reduction approach, knowing that for many people, younger and older, people are still going to be engaging in certain behaviors, like sexual behaviors, like substance use. And so how do we just encourage folks, particularly in a time where there's, a pandemic and a virus that could easily be transferred among folks who are in a cohabitating setting, is what are some harm reduction approaches that you can utilize when you're doing those behaviors.
Thank you. Anything you would like to add, Natalia, before we move on?
I guess I would just add on the medical side that a lot of clinics are offering teleservices, including for, obviously, you need to go in to get samples drawn, such as for STI testing, but you can get PrEP online, you can get different antiretrovirals started and refilled online, you can get hormones prescribed and refilled online. So I think kind of the more clients, kind of know about those services and hopefully get increased access to teleservices, that at least reduces the kind of, or helps the harm reduction model a bit in terms of where people are getting things and how adherent they are to their meds.
Yeah, and in LA County, at least for folks who need a provider, the center, as I mentioned, is still open. And so among other incredible providers like Children's Hospital and St. John's Wellness Center, all of our sites are still providing testing, fentanyl testing strips. I mean, the whole gamut of those different services that we would typically provide, whether you're in Hollywood, South LA, Boyle Heights, you name it.
Yeah, and I would just add to that fortunately prescribing guidelines have been relaxed during this era, as have state licensing guidelines in a lot of places. So that means, for instance, that patients can receive longer prescriptions for controlled substances such as methadone, buprenorphine, than they could before. So that hopefully will at least help improve adherence and decrease withdrawal and kind of increasing street drug use for people that are already enrolled in programs.
Great, thank you so much. This is a little off script, but I feel like among our LGBTQ plus youth, there's often so much resilience and so much adaptability demonstrated, particularly among young people who throughout their lives have experienced incredible difficulty and incredible challenge. And this is more on top of that for them. And I'm wondering, before we go to our next question, if you can think of or highlight ways that you've seen your young people and the young people that you work with really adapt and really show up during this time in ways that have been surprisingly resilient and surprising and perhaps positive. Because I feel like we could talk all day about the challenges, but it's also important to really highlight what's going well for these young people. You want to start, Ariel?
Yeah, I thank you for mentioning that, because yes, certainly we can talk about all of the different negative outcomes and challenges, and it's important to recognize those pieces so that we can address them. And we are talking about an incredibly resilient population. We're talking about not only LGBTQ plus youth, but primarily LGBTQ plus youth of color in this work that I do. And so there's, multiple identities that they're carrying at any given time, where they are oftentimes having to overcome a lot of structural barriers in how they navigate the world. And I think it's important to underscore that piece as well, because I think sometimes there's this misconception for that, being LGBT increases your risk for these sort of things, inherently, right? And understanding that these things aren't happening because you're LGBT. Rather, we have a lot of systems in place, or lack thereof, that aren't responsive to somebody. And so I think that's just one thing I always like to remind folks, is that, as you said, the youth that we work with are incredibly resilient and resourceful and creative. And the risk factors that they may have are not because of who they are, but because of the ways that we respond to who they are. So, one thing I love that we have, these different peer positions, they've been creating weekly sort of booklets for folks to do different care exercises, everything from coloring to meditation, resources. That was something that they started recently, which I thought was really cool. A lot of our groups, as many organizations are doing, are going online. And so, transferring that, and I've seen people get very creative on different platforms like Snapchat, Instagram, TikTok. There's probably more that I don't know of, but seeing how folks are using social media to stay connected with one another during this time, and in some ways be able to maybe extend their connections to folks who they otherwise weren't connected to, I think has been really neat. And even here at our youth center for our residents, despite of everything that's been happening, folks have generally remained pretty calm, pretty supportive of their peers, and really open to the different activities that we've come up with, designing activities. And so, we've been trying to make sure folks are able to stay busy and feel supported. One of the things that I'm personally working on is I'm putting together some Pride care packages. So I've had a number of social workers and providers and youth reach out saying, we're really sad because we're missing out on this event that we look forward to each year where we can feel celebrated. Do you have a sticker? And so after getting, so many of those requests, I finally said, you know what, we can do better than stickers. We can do a care package for you. So, that might be something, as well as folks are thinking about what you can be doing, or how you can translate some of this, is how are you taking care of the folks at your agency and within your capacity.
Awesome. Thank you. Natalia?
Yeah, Ariel, that's all amazing stuff the center is doing. I can add a few kind of tips more on the mental health side. So as we've been discussing, a lot of our youth have a lot of, sort of adaptations or skills that they use to get through their day-to-day stressors. So one of the things we've really been doing is helping youth tap into those existing skills that they have. And a lot of youth have them and don't even really recognize that there are things that they do that help them control the way they feel. So that's a big part of the therapy work that we do. We teach a lot of concrete skill building, such as, assertive communication and how to regulate your mood in different ways. So basically it's kind of the same skill sets, but applying it to a new environment in our kind of COVID world. I think the online support community has also really been stepping up. A lot of programs, including our own and Arielle's, have been launching online services and availability that wasn't there before. There's also a lot of great LGBTQ media that's out right now. And a lot of our teens will hang out with friends online and maybe watch something together, or just have like a regular kind of hangout with someone that's supportive and a positive part of their lives.
Thank you for highlighting the things that you see that are great and positive about this group of young folks. Let's go to our next question, and it sort of anticipates that we're going to reopen and recover from COVID-19. What do you imagine, or what unique supports do LGBTQ youth need in the weeks that follow this pandemic?
I'll let Natalia go first on this one.
So I think one thing that we know to be true is that a lot of our LGBTQ youth can have a lot of anxiety, especially in social settings and sort of in the world at large, which oftentimes doesn't treat them very well. So, you know, in some ways, being away from those stressors is a little bit comforting, or reduces, you know, stress and anxiety for some, not for all. So the sudden kind of forced reintegration into schools, camps, public spaces can be really distressing for some of our youth, especially those that are socially anxious and or dealing with you know, different forms of gender dysphoria or dysphoric thoughts about their bodies. I'll let you add to that, Arielle.
Yeah, you know, one of the things, as I mentioned, working around child welfare and juvenile probation, is we have a lot of young people who are in a congregate care setting. So unlike youth who might be in a family home and be anticipating that reintegration at any point in time, depending on where they are, you know, we have a lot of youth who right now have had increased isolation because they don't have providers and other services that are typically provided to them in person able to come to them, say at a group home or other facility where, you know, that might be the person that they rely on every week or however often, who maybe they feel understands them, at the very least affirms who they are. And so I think in many ways, you know, that will be great when we're able to safely sort of resume that type of service provision, depending on where we're at. And again, I think to Natalia's point, that can also create some stressors for folks who, especially in congregate care settings, may have had to really think about, you know, for example, their gender expression right now when they are in a space that isn't supportive and they don't have somebody who's coming in to really advocate for them on a more regular basis. And then, as I mentioned, those resources, making sure as well that families are supported now and moving forward, that they have access to different resources that are going to allow them to work through some of these feelings, reactions, behaviors, et cetera, that they may have to the youth in their lives. And something I think that, capacity allowing, I think folks should definitely be thinking about some sort of wellness check. So if you're a teacher, if you're a clinician, no matter what your role is, does your agency have the capacity to be just doing quick little 5-minute calls maybe with folks and just saying, how are you doing right now? I think that allows us, you know, to not only check in around physical health and, for example, making sure things like COVID symptoms are being addressed, as well as mental health, emotional health, and any other needs. Needs like, you know, food instability, for example, where many youth may be relying on their, you know, school or college campus to access things like food resources and meals. And so all of those things, I think, you know, culminate into a lot of different stressors, but also from a strengths-based perspective, a lot of opportunity for us to be able to provide those things.
Absolutely. Natalia, you talked about, you know, LGBTQ youth as a population struggling with anxiety. And I'm wondering, as we talk about, and not to be overly general, but as we talk about, you know, going back to school and sort of recovering and all of those types of things, like what do providers in particular need to be thinking about, and how can they start getting ready? How can teachers perhaps start preparing to address not only what's happening in front of them, but perhaps like what's been happening in the preceding months, where needs were not being met, voices were not being heard, and so forth.
Yeah, thanks, Taylor. I think there's a lot of kind of different dimensions to that. I think it's probably worth saying that there's so much uncertainty kind of all around in the world for each of us included. This is a very unique stressor, COVID, in the sense that we're all dealing with it. It's very different than when you have a patient or a student that's going through something, but it's not your shared experience. So I think, it's just kind of worth acknowledging that we're all kind of navigating the return process together. I think that's actually a very useful message to share with youth, right? Is that this is a collective experience. You're not going through it alone. And we do a lot of problem solving with youth about kind of what they anticipate when the next change comes. So for instance, if they have to go to summer school in person, what's that going to look like? What are they going to wear? Where are they going to go? If it's appropriate, we'll sometimes have youth sort of work towards that in advance. So for instance, practicing leaving the house, driving by the school, if they're planning to come out over the summer, maybe taking a step towards that, so that it's a little bit less of a sudden transition in whatever small ways that we can control, knowing again that, the greater context of the world right now has a lot of stuff that really none of us can control.
Yeah, those are such great tips. I love the working toward reducing a sudden transition. Can you maybe, I like the examples that you gave. I think they're really helpful. Maybe, do you have any others in mind or other circumstances that you've seen with the young people that you work with that might be relevant to the audience participating?
Sure. I mean, there's a lot, we have a lot of kids that, for instance, started hormones during this process. And so, they're going back into their social worlds with, maybe slightly different, characteristics in terms of their gender expression. Obviously, a lot of kids have continued to transition during this time. So they're going to go back and sort of suddenly face the social aspects of that, whether it's talking to schools or telling friends or seeking other supports in the community. So, I think it's kind of helpful to remember that kids' lives didn't stop during this, and that kind of all the usual social youth stuff is still going on. So I think any ways that we can kind of prepare them and, again, sort of problem solve with them about how they're going to cope with that, with this sort of, post-COVID sudden changes kind of world is helpful. Fortunately, a lot of kids, will start to have better access to care and their support systems again simultaneously. So I think part of the planning process is, how you'll be able to use those as you sort of transition back to school or to college or to work.
Yeah. Ariel, anything to add on that?
I think Natalia really hit on some great points and tools. And I think also letting folks know, one of the things that I've seen reiterated in so many spaces, and I think is so true, is, whatever circumstance we return to or create, right, this is also an opportunity. And so for the adults and the providers on today's call, thinking about what are some of these things that we can maintain. So if you are doing something like a virtual group, apologies, my automated light keeps going off. Are those some of those things that you can maintain, right? Because those might be really great things. So telehealth is excellent. And then, for example, we have our Community Action Network that is doing weekly GSA meetings. And is that something online that similarly support groups or other things can remain in those spaces? So I think also for the providers thinking about how do you create some consistency, or at the very least, maybe several weeks into sort of the reopening of the area that you're in, so that it isn't that sudden transition of school's back and we're going to just sort of act like everything is normal, none of this happened, and sort of resume life as you knew it, right? So for all of us, it's going to be a process to sort of step back into that reality. But certainly for LGBTQ plus youth, there might be additional stressors or areas where we can provide additional support.
Yeah, and I was sort of thinking that to that end, it might be the case that some youth have really connected during this time online in ways that they weren't connected before, that might be helping them perhaps. And then to pull that rug out from under them would be hard. And so it's also transitioning in the other way, that I think could be really helpful in a slow and methodical process. So thank you for raising that. We're getting, I'm going to transition us to our next question, but before that, some folks are asking about Pride and some ways to celebrate Pride virtually. And as we get closer to Pride Month, I'm wondering if you have any additional ideas or suggestions to share.
I definitely do. So in the chat box, I'm going to put in some links to some different resources as well, just generally so folks have them. So I put the center's information there and my program Rise in case folks are interested in additional sort of development for staff. But some key resources I think for youth right now, there's Q Chat Space. It's run by Centerlink, which is the National Association of LGBT Centers. Many LGBT centers like ours are still open and functioning, a lot of our programs. And so Q Chat Space runs a variety of online spaces for youth every single week, as well as Gender Spectrum. They specifically work with transgender, gender nonconforming, and gender expansive youth, as well as their families. They're running incredible groups online for youth and for adults separately. And I think they also may have a provider group as well. And so that's something to check out. And then the last one I wanted to highlight was the Trevor Project. So if you're not familiar with Trevor already, please mark it down. It's a suicide prevention organization, and they have 3 actual ways that youth can be in touch with them. They can go to trevorproject.org and connect online using their Trevor Space online network. They can text. They can, what else can they do? They can also do the Lifeline, which is sort of a suicide prevention hotline. So those are a few resources just generally. Pride specifically, though, I know, again, it's coming up. June is Pride Month, and we're not going to necessarily see all the fun rainbows and glitter and things that we're used to. And so we, for example, the center have taken Los Angeles Trans Pride virtually. I put that link in there, and that's happening later in June. So folks can tune in and join us for Pride, Trans Pride virtually. I know Los Angeles Pride, New York Pride, a lot of these different prides in major cities are also going online, TBD on what that will look like. So maybe that looks like hosting a viewing party, for example, on one of these cool apps and being able to do a viewing party for the DJ hour, or something like that, right? I think as well, this week we have Pride Week in our youth center. And so we decided to do a themed week. We have a different theme every week. And so each day there's different things happening. And so maybe if you're at, a congregate setting, that might be something that you think about. How do you carry Pride through at your organization during this time? And then I think, as I mentioned, for those youth who might be at home and more isolated, there are different ways that you can help them celebrate Pride. So there's a lot of great online resources, everything from neat books, sort of party supplies, you name it. I think that might be a nice way to bring folks into that celebration spirit.
Thank you.
I don't have too much to add. That was a really awesome, comprehensive list. I guess I would add some youth really benefit from finding some small thing that they can do for an LGBTQ cause or for the community more largely. So whether it's, a small online fundraiser or signing up to volunteer, there's still a lot of volunteer things you can do remotely, especially with social media and development. I think that, and then as Arielle alluded to too, just really thinking creatively about ways to meaningfully express and embrace your identity during June, if that's, an important month for you. And it could be smaller things too, watching a movie with a friend virtually and discussing it. Some of our kids will bake or craft together. There's a lot of different LGBTQ themed crafts you could probably come up with. So, I think thinking about kind of what's accessible and, feasible, and then within there kind of brainstorming. And as Ariel said, I think, the online community has really stepped up. So really helping youth that can connect to those resources connect.
And I will just add very quickly, because Natalia perfectly teed me up there. Yes, there's so many virtual online opportunities. We have tons, including a program we started called the Hello Club. And so that's an opportunity to connect with LGBT seniors who are also experiencing isolation right now. And that's something that folks can be doing from home. So there's definitely spaces for folks to volunteer and be connected to their community. If folks also are feeling crafty, as you mentioned, Natalia, and are in a lower budget, one thing that we've done at different events is a little affirmation station. And so this is just take some colored paper. Somebody made a bracelet attached to this with the trans pride colors. But this is something that you could easily create either for yourself, right? Write yourself an affirmation, or make one for a young person in your life and mail it to them and just let them know that they're special. So that's a low cost thing that you can do. And it doesn't take a whole lot of creativity if you're sort of challenged in that arena, as I am.
Those are such great suggestions. Thank you all for sharing. And I hope that was a helpful insight for the person that asked that question. Thank you both. We've talked a little bit about resources. Ariel gave us a wonderful list. But do you have any other suggested resources that you would turn folks to at this time? Let's start with Natalia.
So the Youth Advocates Coalition, I don't think we've mentioned yet in this discussion. I'll post the website shortly, but it's basically, there's a group leader that kind of coordinates all the various groups all around LA County, from the center to Empower UCLA to San Gabriel Resources. And they put up a really nice calendar of events, and it's just kind of a good central space to go get ideas, especially if you're feeling kind of stuck or don't know what's out there. I don't know if we talked about PFLAG yet. That's a good, PFLAG LA is a great resource for caregivers and family members, and youth themselves too can participate, though it tends to skew more towards caregivers. PFLAG is running phone support. I think they're kind of working on launching their online groups for parents. But those are probably the two that come to my mind right away.
Thank you. And did you say it's PFLAG?
PFLAG.
Yeah, I'm gonna post, I'll post both links in the chat right now.
Thank you.
And PFLAG actually runs spaces nationally. So if you're not in the LA region, they have support groups practically in every small corner of the country, and actually internationally, oftentimes in other languages, and facilitated by faith leaders or other folks who can really connect with parents and caregivers in unique ways. So PFLAG, thank you. Second that, Natalia. Excellent resource. At the center, we run a monolingual Spanish speaking support group as well. And so if you have folks who actually, because it's online, or LA and beyond, who are monolingual Spanish speakers and are seeking support during this time, we'll definitely be sure to connect you. You can just go to our RISE website, which we put in the chat box, and you can access that.
Thank you. And I also want to thank Brian from DMH posting DMH resources in the chat, as well as some additional websites, and BNStar for Spanish speaking services. So thank you for that, DMH. And we have just a few minutes left. Wondering if we can talk about policy recommendations that you might advise during this time. I know, for instance, we saw a lot coming out of the governor's office really early, particularly around youth and foster care. Any other recommendations that you may have?
I mean, I have plenty. I could keep you all day. I think one big one is the improvements that we have had in access to care are really, really important to keep. So expanded telecoverage, both for federally and state funded programs, but also private insurance has been really, really key to a lot of people being able to get services during this time. The other thing that I would sort of put on everyone's radar is the Section 1557 of the Affordable Care Act is under threat by the Trump administration. That is the provision of ACA that prohibits discrimination against LGBTQ patients in healthcare. So that's a really, really important piece of legislation to keep intact that really affects folks all over the country, including here in California.
Ariel?
Yeah, certainly when we're thinking about, any scale of government and policy making, thinking about the ways that different identities intersect. And so, at the center, for example, we serve a lot of LGBTQ plus youth who either are undocumented or who are seeking refugee status. And right now that's, under incredible threat. And so how do we ensure that youth will continue to be able to access those services and legal options, I think, is of great concern to us, and hopefully folks can work around that. Folks can also be advocating around things like, the CARE Act, where, as I mentioned, LGBT centers across the country remain open oftentimes in providing these critical services, but a lot of nonprofits aren't being considered in many of the relief packages. And so that's something that, as we provide resources to the community, we definitely hope that our partners in this work will help us continue to provide those services. And then I think something that isn't necessarily funding related, because I know that may be an even more difficult conversation than it likely was beforehand, as far as having sort of dedicated funding for programs and services. Policy and implementation is always key, and that's where sort of my brain lives, as you know, Taylor. So thinking about, it doesn't cost any money for your agency to be thinking about what policies do you have in place, what procedures do you have in place, and are they being implemented? So do you have comprehensive non-discrimination policies? Do you have policies around confidentiality and disclosure? And have staff all been trained on those things? And those are things, like I said, putting those policies into place, that doesn't cost any money. And then staff development ongoing is really key. So making sure that staff are supported and being able to receive training and coaching services so that during this time and ongoing, they are able to provide culturally responsive services to the youth that they're serving.
Wonderful. Thank you.
Can I just add real quick that there's a lot of free, very good online training available at kind of all levels of the system, all the way from administration, all the way to workers providing direct services. The Fenway Institute has a wonderful online program that is all free with registration. Our website through the COE, wellbeingforla.org, also will be launching a lot of new LGBT training resources. And Arielle, of course, and everyone at the center has a lot of great materials online. So these are really kind of low cost or free ways to get people trained up a little bit more during this time.
Beautiful. Thank you both. I'm so grateful for your participation today, for the questions that we received from the audience, for everybody's attendance and joining us. I think everything you shared is not only relevant during COVID-19, but certainly as we recover and as we all go forward together in navigating this new time of our lives. So let's give our speakers a round of applause and thank them for joining us today. And we'll follow up with sharing some of the resources that both Dr. Ramos and Arielle shared with all of our attendees today. So any questions, feel free to reach out to us at the UCLA Pritzker Center. And we have our last speaker session of the speaker series on Thursday from 12 to 1 regarding transition age youth, where our wonderful program coordinator Ruby Tucker will be joining us, among others. So please feel free to join us then. And again, thank you so much to Dr. Ramos and to Ariel for being with us today. And thank you for all of your hard work and for being on the front lines serving these very important young people. We appreciate you. Thank you all so much.